My name is Elise Loxmo, and I had the migraine decompression surgery, and I had Dr. Amirlak perform the surgery. It was a really good experience. I'm very happy that I had the surgery. I was very skeptical going into the surgery and nervous, and there wasn't a lot of information out there. So I didn't really know what to expect, but I've had really good results, and they've taken a lot longer than I thought that it would. You know, I just hoped for the immediate fix, but today's 5 months since surgery, and you know, I'm doing really well. Before I had probably 2 to 3 migraines a week. Pretty much had a constant headache for about a year, every single day. And that's just how I learned to live life, and I was working like that, and you know, doing stuff at home and with family and friends, and just kind of suffering in silence. I started having headaches when I was 18. It was my senior year in high school. Probably some stress, maybe. But I started taking some medicine, and it was very sedating. I was sleeping like 16, 17 hours a day and going to school, so I was sleeping some at school, and just was not very happy and just in a lot of pain. Did the typical MRI, CAT scan, that sort of stuff, and everything was normal, so it was just kind of like, well, here's your life. So I spent the next 10 years just kind of learning to live with it. I guess that I hadn't ever realized how bad life had gotten, that I wasn't living life. Like, I hadn't been to a movie in 4 years. I hadn't been to a concert in 6 years. There were things I couldn't do if there was a certain smell or a certain sound or anything like that. I couldn't ride in a car, I could only drive. And so just things that had really halted my life, but I learned to live with it, so I just had assumed, like, well, this is how it's gonna be, and you know, you just don't always think that there could be something different once you've tried every medication and every, you know, crazy thing known to man. You just think that that's how it's going to be. I've tried blood pressure medication, I've tried seizure medicine, I've tried antipsychotics, I've tried like Prozac, Effexor, you know, just kind of everything anybody could throw at it, I've tried. And then I'm very open to trying anything that's going to work or might work, and so I've done like hypnosis and acupuncture. I had nerve block injections. I got staples in my ear. You know, just everything. I've tried it and just didn't find anything that worked. The surgery was a little tough. I was not expecting it to be as hard to recover as it was. I had the frontal and the temporal, and then the lesser occipital surgery. Those 3 sites done, and I think that having them all at once was kind of hard. Whenever I got home, it made it hard to find a place comfortable to sleep, because you'd had stuff on the back of your head and then on the side of your head, so it was a lot of kind of like sleeping up, and you know, but I was very, very, very blessed. I'm a teacher, and so I got to have the summer, and so it just really allowed me to let me heal and just recover kind of more slowly than I would have had I gone back to a job. But I did go back to work to like finish up the year. I went back after 10 days after surgery and was able to stay the full day at work. I didn't get much accomplished, but I was able to be there, and then go back again in 3 weeks and work a full 40-hour week. So I know that it's possible to have that much surgery and get back into kind of daily life, but it definitely took a little bit more than I thought, because I guess I just have always pushed through the pain, and so like for the first time it was my body actually being like, no, you need to rest. I guess the second month is whenever I really was able to fully resume life, like working in the yard and doing house chores and going and running errands. I remember going to the grocery store I was like, phew, you know, it was a 2-hour trip to the grocery store, but it was something I hadn't done. And, you know, so it's an adjustment, but I have to say, like, the first time that I've allowed myself to take care of me first. And the thing that I guess I wasn't expecting, which I feel like is good to know, is that there is a lot of swelling, because it's a lot of trauma to your face, kind of like the same thing as having a facelift or something like that. And so, you know, I had a lot of swelling in my cheeks and in my eyes and some bruising. But almost all of that was gone by the 9th day after surgery, which was the next day I went back to work. And so I just put a little bit of concealer on, and people were kind of like, didn't you have surgery? And I was like, yeah, look. Okay. So I have one scar right here that goes up into the hairline. Then I have another scar right here that goes through the hairline. I also had a blood drain right here. Then I have this guy right here. It goes up through the hairline, and at first it wasn't growing hair really. The hair has started to come in, but he also said that he has different stuff that he can do later to help fix areas if the hair won't grow back in those areas. And then I have another one right here. And then there's one in each of my eyebrows that you can't see. I didn't even know. Okay, I have this one. And then one right here. One right here. And then one up in here. And one up in here. It was a really good experience. My first time in a hospital, first surgery, so it went really well. Yeah, it's good. I'm happy. I'm really, really happy. Today's 5 months, and I'm doing things that I just didn't ever think that I would get to do. My parents and my husband say that I'm like back to the person that I was however many years ago, you know, that I can joke and have fun, but it's not, you know, it's not like I'm covering up my pain, but it's actually really genuine. And, you know, I even went to a musical 2 weeks after my surgery, and both my parents were just like sitting there like, because they were so nervous with all the loud noise and everything. They just thought that like at any second that my head was just going to go off, and I was just able to sit there and make it through it. So that was kind of like the first true testament to it of, okay, things are a little different, you know. So that was exciting. So I've seen my neurologist who I started with, and I had Botox with her in January, and then I had the surgery in May. I saw her yesterday, actually, and she was just really, really excited to, you know, encourage patients to look at this side of it, the surgical side of it, because she's also, you know, had great results with Botox, but it's kind of like, and then what? You know, so the way that I look at this is a more permanent, you know, form of the Botox, because it's doing the same thing, just letting those muscles relax and stuff like that. So she was really excited, and I'm really excited. So that was nice to be like on the same page, and finally, like, I just went in and saw her and said, hey, this is how I'm doing, and I left, and that was just a really good feeling. The side effects that I've had since I had the surgery is from here to here probably, is pretty numb still, and I'm a little ways removed from the surgery. Whenever you come out of it, it's kind of from here to here, if you have the front and the occipital done, is, I guess, kind of, like if I press on it, it's kind of tingly feeling. It's just a weird sensation. The way that kind of Dr. Amirlak has you work through that is by using different kinds of brushes so that you desensitize the area and stuff. So that's been kind of weird. But I've also had some nerve pain, nerve sensitivity, and it's kind of been in the hairline, And it's sometimes whenever I get hot or my body temperature rises or blood pressure, it'll kind of be a little bit of a burning sensation. The physical therapist that I have is able to like really work on my scars and massage them and work out any scar tissue. So that's been really nice, so that my scars are just going away, you know, and they can't even see that I have 14 scars, 6 of which were on my face. Best thing about having a plastic surgeon do it is that you have amazing scars and nobody can tell, and they're, you know, in very strategic places, and so it's great. You just look normal afterwards. You just fold your hair over a certain way and you're good to go. Some people might be scared, you know, some people just like looking at my pictures and things that I've put on my blog, they're just like, oh, I couldn't look at that. And I'm like, well, you know, then they're like, was it really that bad? Yeah, the migraines were, the surgery wasn't, like, you know, and they're like, well, aren't you in pain? Well, yeah, but I've been in pain every day for the last 10 years. Like, this isn't any kind of different pain, you know, it's just another day, but there's a light at the end of the tunnel. Been really happy with it, really, really happy.